Time for this morning's checkup, and there's some new, really interesting research shedding light on the 12 most common symptoms of long COVID, and you can see them there, including illness after exertion, fatigue, brain fog, dizziness, stomach problems, heart palpitations, changes in sexual desire, loss of smell or taste, thirst, chronic cough, chest pain, and abnormal movements. Scientists were also able to confirm the results of some other studies that found that long COVID can impact multiple organ systems in the body. They determined that people who were not vaccinated, people who had suffered multiple infections, and people who had their first infection before 2021 and the Omicron surge were more likely to have long COVID. Joining us this morning to talk more about it, emergency medical physician and medical director, Dr. Richina Bicette-McCain. Doctor, thanks for being with us. Now that we know the symptoms, right, we've labeled the symptoms of long COVID, are we any closer to understanding how to treat them and stop them, cure them?
Well, I think it's important that we establish a definition first and foremost, because early on in the pandemic, there were just slow rumblings from patients who had contracted COVID, and months later were saying that they were still symptomatic, but we didn't know what was causing it or how that could possibly be when they had recovered and their tests were negative. So now that we have a definition, we can start recognizing it as a condition and figuring out if there are ways that we can potentially treat it. I don't think we know exactly what's causing it, though.
But there is some talk about these viral reservoirs. What does that mean?
So basically what a viral reservoir is that they're essentially pieces of the virus that are remaining in tissues throughout the body, despite someone having recovered from an acute infection. The problem with the viral reservoir theory, however, is that there are a lot of people who potentially still have pieces of the virus in their system after contracting COVID, but not all of these people have long COVID symptoms. So there is still something else at play here.
The symptoms are varied, right? There's a lot of different things on that list that people are seeing. Some have multiple symptoms. What are some of the, now that it's recognized that it is a condition that people are dealing with, ways to combat it, given the varied of symptoms?
You know, there are differing thoughts on that. There are those who go with the homeopathic natural remedies, vitamin C, echinacea, vitamin D, lots of hydration. But honestly speaking, there isn't really anything medical that we can do about them other than treat what you feel that you have. So for example, if you have chest pain, then we'll give you pain medicines for that. Or if you have a chronic cough, then we could potentially give you cough medicines. Some things are a little bit harder to treat, like the fatigue or the brain fog or the general malaise that some people may feel.
Do any of these symptoms go away on their own, or are people still 3 years into this dealing with some of this?
Well, patients with long COVID have differing courses. There are people who have persistent symptoms, symptoms that never go away. There are people who develop new symptoms over time. And then there are others whose symptoms wax and wane. They go and then they come. So yes, it is possible that your symptoms may go away, but we're 3 years into the pandemic and we're still finding out new information. So I think that's still to be determined.
And is COVID the scapegoat here? I mean, might some of these symptoms be related to something completely other than COVID-19?
Well, Marni, that's the important reason why we had to define this long COVID or post-acute COVID infection syndrome, because patients may have multiple symptoms that are due to other things. But this particular study looked at almost 10,000 patients, 89% of whom had tested positive for COVID. And then they drilled down the most common symptoms amongst them. So it does make sense that if a patient is experiencing these symptoms after having an acute COVID infection, that it's likely due to long COVID.
Got it. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.